We are a team of Australian researchers who have come together with 6 patient advocacy organisations in order to support patients, doctors and regulators to make better decisions about when and how to access treatments that use stem cells. A key focus of our study was hearing directly from Australians living with and caring for those with multiple sclerosis about their views concerning access to stem cell treatments. Specifically, what is referred to as autologous haematopoeitic stem cell treatment, or AHSCT, also referred to as a stem cell transplant using one's own cells. At present, this treatment is only available in Australia to patients who are accepted into a clinical trial. This means that at the time of our interviews, anyone not eligible to participate in a clinical trial could only access this treatment if they travelled overseas. In this short video, we would like to illustrate our main findings by using quotes from Australians living with multiple sclerosis who participated in the study. All participants acknowledged how serious a decision accessing AHSCT would be for them, often noting that there were no guarantees that the treatment would work. For many, how their symptoms were progressing was a significant factor. One told us that the decision to pursue AHSCT overseas was quite easy, as it was, in their view, a choice between treatment and dying anyway. Many expressed frustration about the difficulty of accessing this treatment in Australia, especially with joining a clinical trial here. As one participant explained,
they were so specific about who was to do the trials because at the time I'd only had 2 attacks, being the double vision and the numbness in the feet. I wasn't bad enough.
Some participants shared how their decisions about trying AHSCT involved a weighing up of the potential risks and benefits of the treatment.
I know there's a risk with the stem cell transplant, obviously, and one of those risks is death, but funny enough, it's the same with most of the drugs you're on, so you have to weigh up the risks and rewards and things like that.
They discussed how AHSCT might compare with the other treatments available to them. A carer commented,
"The way we look at it is that while taking the medication that a lot of MS sufferers do over time, that can have a very detrimental effect on their health. It's not ideal to be on these medications for decades, so if that can be avoided by getting stem cell treatment, that's very encouraging."
Participants expressed a huge desire for more information to be made available and easier to find. As one commented,
I consider myself to be quite information literate, but there's just so much information there. Some of it's conflicting and at times can be difficult to make sense of, for even someone like me.
The healthcare professionals we spoke to also acknowledged that inconsistent information was making it very challenging for Australian patients and their families, and better information was required around who is eligible for trials, who isn't, and why. This research shows how vital it is for consumer perspectives to be included in public discussions about access to experimental treatments. These voices highlight the real-life challenges, needs and priorities of people living with multiple sclerosis. Our findings emphasise the importance of ensuring that reliable, complex and up-to-date information is readily available to Australians living with multiple sclerosis and their loved ones and carers, so that consumers and their doctors can have nuanced discussions about treatment options, and so that policies governing access to new treatments are shaped by the perspectives of those living with multiple sclerosis. We would like to thank the many Australians who generously gave up their time to speak to us for this project.